distinguished delegates, ladies and gentlemen, I am honored to join you today for this very important event under the Africa Health and Wellbeing Initiative, which is hosted by the government of Japan within the framework of Ticad 9. And I really want to extend my sincere appreciation to the government and the people of Japan for their steadfast partnership with Africa, and in particular with Kenya, in advancing health and well-being of our populations. The theme of today's event, co-creating the future of health and the economy, Japan-Africa public-private partnership at the forefront, is both timely and urgent. The health sector is not merely a service, it is a driver of economic growth, a foundation of social stability, and a critical enabler of human capital development. Public-private partnership have emerged as a very strategic lever to bridge financing gaps, scale innovation, build resilient health systems, and Japan's leadership in championing such collaborations through this forum demonstrate the power of co-creation, bringing together government, the private sector, the development partners, the academia, and the civil society to deliver solutions that are sustainable, that are inclusive, and are very impactful. If I come to Kenya and Japan collaboration in healthcare or in the health sector, Kenya is very privileged to have enjoyed a long-standing fruitful partnership with Japan in the health sector. Through JICA, we have seen transformative support in strengthening primary health care, upgrading medical infrastructure, deploying cutting-edge diagnostic technology, and building capacity of our healthcare workforce. And just to give two examples, Kenya and Japan partnership in universal health coverage, where Japanese expertise and technology have complemented Kenya's reforms in financing, service delivery, and health information. Healthcare systems through JICA is also found in the maternal health, in the universal health coverage pilots, and in emergency care infrastructure. These initiatives reflect a whole of society approach and validates Kenya's role as a regional innovation hub. How do we harness public-private partnership for health and economic growth? Kenya recognizes that the private-public partnership are not only an alternative, but a necessity. They enable mobilization of capital for large-scale health infrastructure and technology. They help in the transfer of knowledge and innovation from the private sector to the public health delivery. And we have seen, for instance, how collaborations between local manufacturers and Japanese companies can accelerate production of essential medical commodities and digital health tools, hence reducing on imports and improving our supply chain resilience. What do we ask? What are the strategic asks to Japan? Because we have worked with them on local manufacturing scale-up, we have worked with them on climate resilient infrastructure, where we co-invest in low carbon, in modular health facilities, in solar-powered cold chains and supply system, leveraging on Japanese green technology. As we co-create together with Japan the future of health and the economy, I propose the following key priorities for Japan-Africa private-public partnership under this forum. Number one, we must have a sustainable financing. And on this, we need to leverage on Japan's health financing initiatives, the Global Health Strategy Fund, the Global Health Innovative Technology Fund, and the Japan Agency for Medical Research and Development. and of course JICA, in order all of us together we can scale up innovations and we can align it with our social health authority rollout. We can align it with our One Health AMR preparedness, and we can align it with health security and outbreak. Let us remember that health is the foundation upon which we build a very prosperous and resilient societies. By harnessing the collective strength of governments, the private sector, innovators, and development partners, we can create a future where no one is left behind. Let us co-create the future of health and economic growth by leveraging African potential and Japanese innovation. Together we can translate the private-public partnership into real solution, resilient systems, and shared prosperity for generations to come. Kenya stands ready to work hand in hand with Japan and our African brothers and neighbors to make sure this forum becomes a beacon of health innovation where the benefits are shared, where the partnerships are genuine, and where the outcomes are lasting. Thank you. Asante sana. Arigatao. Gozaimasu.
Thank you very much, Honorable Minister. Next, I would like to introduce His Excellency Ambassador Barack